All right, sorry, just need to go through a bit. So just now, as I said earlier, for those of you who joined us a bit late, we primarily started out as a physiotherapy clinic, and we moved into pain education and movement coaching. If you have any questions today, you can ask them, leave them in the chat, and Shen, our chat moderator, will answer them along the way. If we don't manage to answer all your questions today, we'll try and do that on Instagram, on one of our social media platforms. Okay, so as I was saying earlier, what is pain? Okay, so most of you here probably have had some pain. I did see quite a few of your form submissions. Actually, everyone here has pain. Okay, so pain is our body's natural alarm system, alerting us whenever something has possibly gone wrong in the body. Sometimes it's associated with trauma and stress. Stress may not necessarily just be physical, it could also be emotional, it could also be psychological. So this kind of pain can also arise in situations such as movement, okay, when you have too much movement, or you don't have enough movement. So basically you overtrain or you undertrain. So I guess the big question here is, like, why do we have pain? All right, a quick search on a famous search engine will bring you to this page. All right, when your body is injured in some way, the nerves detect the injury, this damage or danger, and it sends the message to your brain. Your brain then responds with a sensation of pain. Okay, there are many reasons for pain, but I'm not going to go through the specifics, as firstly, I'm not a physiotherapist, and so mainly what we'll be discussing today is the mechanical or movement bits. All right, so what can we do for your pain? For those with mechanical pain, we stack. Okay, this is a term you might have heard before if you follow us on platforms such as Instagram or Facebook. And by stacking, we essentially mean we want to align your body by creating better muscular connections and in turn help you function and perform better. Okay, mechanical pain is probably always related to a dysfunction in your connective tissue system. And to understand why we can be vulnerable to pain, we need to understand the human body mechanics. Okay, so let's just start by understanding the human body a little bit. Okay, in the body, we have the skeletal system as a foundation, and also a connective tissue system that links up all these different structures. Okay, the connective tissue system is made up of muscles and other tissues such as tendons, ligaments, and so a failure or dysfunction in the system, usually to an imbalance, can then result in one of these structures giving you pain or even getting injured. So for sustained periods, some of this pain can even irritate deeper structures such as the digestive and nervous system. Things like constipation, pins and needles, and even anxiety can all be linked to dysfunctional movement. Right, so here's an example of my colleague Kurt showing what we will look at as sway back or forward hip posture. So sway back, he's leaning back, and a forward hip posture. If you look at this rounded posture, there's a lot of rounding in the spine here. And overload, there is probably an overload or dysfunction in the pectoral muscles right over here. Okay, pectoral muscles is your chest muscles. Okay, so rounded shoulders can lead to issues such as the overuse of the neck muscles, okay, and even shoulder impingement in the overhead position when you lift your arms overhead. I want you guys all to try this. I know you guys I can't really see you guys, but hopefully you are seated somewhere comfortably and you can round your shoulders. So I'm just going to give you a quick side view. Round your shoulders and try to lift your arms, bring your arms overhead. Okay, are you able to do this? Are you able to bring them overhead? And if not, where do you feel the restriction? Okay, so in a situation where you're stuck in this posture and you need to get something, maybe from the shelf, or you're traveling and you need to get your luggage from the overhead compartment. If you're stuck in this position for a long time and you have tight tissue, you can also eventually easily irritate your shoulders or injure yourself. All right, So many times people who present with this posture are plagued by, okay, so this is another one. If you guys have been working from home a lot and you're caught in this position, or you catch yourself in this position, that could be one of the reasons for your neck ache or your headaches. All right, so going back again, many times people will present with this posture. Every time people will present this posture, have a lot of headaches, chronic neck pain. All right, this is very tight, and even a deeper level of irritation, such as in nerves, and this can be experienced as pins and needles or numbness like down the arm. Okay, to be very specific. Okay, being stuck in this position, so you can see I've drawn some lines over here, also means poorer ribcage position due to tightness at the chest. And this actually can reduce your breathing capacity. Okay, this can reduce your breathing capacity. Okay, so being in this compressed position, all right, your ribcage isn't able to actually expand as much. Okay, poor breathing mechanics can lead to situations such as anxiety, which would also explain the emphasis on, in recent times, on restorative yoga and even mindfulness practice. All right, I'm just going to quickly share another common posture. You might find this familiar. Sorry, it's unlabeled. Yes, as I was saying earlier. How many of you here relate to this posture, this arched back, overly upright posture? Okay, for those of you who like secretly or internally like, oh, I think I'm like that. Issues that accompany this posture here are usually backache, neck pains, and also inability to activate the core. All right, so you see that the core here becomes very distended, very long and archy. It'd be very tough for you to actually activate it in this situation. Other long-term consequences of poor posture, being stuck in poor posture, you have weak and inhibited opposing muscles. So earlier on, as I was saying, in this sway back position, you have what's tight in front at the chest and what's tight behind at the upper back and upper neck area. What then becomes weak is your opposing muscles, your front neck muscles, as well as your mid back. All right. Why do they become weak? In this position, it becomes very hard to actually utilize them. Use the neck flexors, which is your front neck muscles, and your back muscles. So they end up shutting off and becoming even tougher to activate. So basically, go to sleep. All right. I hope you guys have been having some good questions. I can't really see what's happening, but yes. Apart from posture, we've been talking a lot about posture right now. What else can be done about pain? Okay, what else can be done about pain? We have three basic rules to getting stacked at work with balance. You might want to write this down. You might want to take a screenshot. That's up to you. Firstly, we need to reset your joint positions. And our first rule is what's tense needs to be relaxed. Okay, when the body compensates for movement, certain muscles tend to become overactive, overused. In the case of that sway back posture, the overused muscles end up becoming the chest as well as the back of the neck. All right, so these overactive muscles will then benefit from being more relaxed, and that's when your weaker muscles can actually come out and do the job, can start to activate them, and not be overpowered by these overactive, tense muscles. While most rely on manual therapy is things like massage. We have some things that you can try. We have some things here that you can try today on your own. We use foam rolling to relax tense tissue. If any of you here have these tools with you on hand, today, please take them out. We're going to just do some foam rolling. Quick one. Okay, so I'll just quickly talk about the importance of foam rolling here. Why is foam rolling important? Foam rolling is also known as myofascial release. You might have heard this term before. Firstly, tension does not resolve on its own. If this is tight, it's not just going to disappear one day if you're always stuck in this position. Okay, secondly, tight connective tissue can restrict movement and also blood flow. This was seen in the situation where you are stuck here and you're trying to lift your arms overhead. It's virtually impossible, and if you try to force it, you will probably injure yourself. You probably feel tension at your shoulder joint. So that's probably the first area that would get injured. Okay, and thirdly, foam rolling helps to relax and rehydrate tension tissue. All these can disrupt the balance in the body, so it's good to restore the balance by foam rolling. All right, in terms of frequency and duration, ideally you want the area of tension to dissipate, which means to go away or become a drop, the discomfort to drop. So you could easily stay on an area for 3 to 10 minutes. It really depends on how much tension there is in that area, in that tissue. Okay, frequency, if you can, do it on the daily. All right, you may not feel the tightness, but your body is actually tight, and you wouldn't know until you actually start foam rolling, or start some myofascial release on your body. And if you do this on the daily, the effect of course will be much greater in the long run. Okay, one more thing to be familiar with is the discomfort level. When I say discomfort level, I do mean how painful or sore it is. Some people think it's really, really pain. So honestly, it depends on your pain threshold. 1 being it's mostly insignificant, 10 being it's so painful I need to stop now or I'm going to cry. All right, you want to spend a significant amount of time on each area, serving each area, so that you give it enough time to relax, and that you have enough time spent on it, so that the discomfort level maybe a discomfort level starts from an 8 out of 10. You're like, oh, it's really tight, but I feel like I can still stay on. But maybe after 5 minutes, your discomfort level drops to a 3. Or maybe, okay, let's be more realistic. Maybe after 5 minutes, your discomfort level drops to a 5. Okay, that's good. Keep going. Try and get that tension as low as possible. You may not achieve it in the first foam rolling session, okay, but it will take some time. But at least you can understand what is the amount of tension and amount of discomfort you want in that area. All right, key areas that we're focusing on today that are most commonly tense in the upper body: your pectorals, which is what we talked about earlier. Okay, your rotator cuff muscles, that's the back of your shoulder. Okay, your latissimus dorsi, which is right over here, and your thoracic spine, which is right down the middle of your back. All right, we're gonna start off with the pectorals. If you have a tool, I'm gonna be using a ball for this today, and I'm gonna move to the floor. All right, I'm gonna be using this ball. What I'm gonna do is we're gonna be placing it on my pec muscle here, right at the chest. Okay, you can use a wall or you can use a floor. I prefer to use the floor. So what I'm going to do is I'm going to lie on it. Okay, I'm going to be lying on it. I'm going to be breathing into it. Okay, if you have a ball right now and you want to test it out, you want to try it out, let's go ahead. I'm going to spend a couple of minutes here. Okay, sink into it, press if you can, breathe into it. If you feel it's tight, that's great. If you don't feel anything, what you can do is either grab a tougher ball, a stiffer one, or if not, use the wall. So same thing, you want to sandwich the ball between yourself and the wall and pressure it down. Okay, so spend a few minutes and breathe. Okay, try and get up to about 10 breaths. Change sides. All right, change sides, and then just think about how much discomfort and tension there is in that area, and let that slowly come down. Try not to get the pain to be too high. Otherwise, your entire body will tense up too much. And when your body is too tense, it is also ineffective and has a reverse effect. All right. Okay. The next one we're going to do is the rotator cuff muscle. For this exercise, I'm also going to use the ball. You can choose to use a foam roller. So I'll just show you what my foam roller looks like. Okay, I'm using this small tube foam roller. I'll be using this. I won't be using this foam roller. I'll be using a ball. Sorry, but I'll just show you how this is going to look like. All right, I'm going to be lying down, placing the ball where my rotator cuff is. It's like where the armpit is, and then you roll it back a little. So where your armpit is, and then you roll it back a little. All right, and then what you can do is lie on the floor. Lie on the floor. Okay, in this fashion, you can relax your arm. All right, once you've gotten the ball sandwich there, you should feel a bit of a twinge, a bit of a discomfort. And what you can do is you can move your arm through the motion, or if it's too painful, you can just rest and press and breathe. Again, spend enough time on this area such that the level of discomfort drops. Try not to be in too much of a hurry to get this to improve, all right? And then move on to both sides. Okay, the third one is your latissimus dorsi. So if you can see in the image there, I'm going to be using a tube foam roller for this. Okay, this is just a small tube. These come in various sizes. It really depends what you have or what you can find at home. Otherwise, some people even use a PVC pipe. All right, I'm going to be putting it where the image is. I'm going to be lying down on the floor, same fashion as the rotator cuff, where you're rolling a rotator cuff. And if you can, if this is pretty comfortable for you, what you can do is also lift your bum off the ground, like what I'm doing now. Lift your bum off the ground, and if you want, you can roll the area. So this might be a bit more painful for some of you, a bit more tight for some of you. All right, again, if it's very tight, try not to force it. Try not to keep your body in a very tense fashion. It is not an exercise. You shouldn't be feeling a burn anywhere. You should be trying to relax and release your tension tissues, not create more tension. Okay, both sides for your lats as well. Rotator cuff and lats, both sides. Okay, for the last one, I'm going to be using a peanut to roll out my thoracic spine. So this is what a peanut looks like. Okay, peanut. There are various sizes for this, small and big. Okay, I'll be using this. I'll be lying on top of it. So my T-spine is mainly from here to here. I'm going to be lying on top of the foam roller like this. I'll support my head a little bit so that I'm not flexing my neck too much. Okay, relax the neck. If you feel like this is not doing much for you, what you can do is again lift your bum off the floor and roll. Okay? Some people improvise. They use two small balls. They tape it together. They use two small balls, they tape it together, and then they do the same. That works too. All right? That works too. I do find that this works better. This peanut one works better for the upper back as compared to just a flat roller because it really gets into the grooves. Okay, so spend, again, 3 to 10 minutes per area. There's no set time limit for this. Do it on a daily and improve your tension tissue. All right, I'm going to go back to the table. Okay, if you have any questions about myofascial release, do spam Shen in the chat room. She just laughed at me. Okay, don't spam her maybe. All right. I'm going to move on to the next rule. What's short needs to be lengthened. Using the case of the sway back posture earlier, the rounded shoulders posture, tightness can also lead to a shortening of the muscles right over here over time. All right. It is then important that these short muscles need to lengthen so that you can rebalance the body. Okay, so that's really important. After the first step where you release the tight tissues, let's say your pec is tight, you release the tight tissues, you need to rebalance it, unshorten or lengthen the muscles. Okay, generally chronically tight or strained muscles, they are stuck in patterns of compensation, end up causing pain. So this is something that you guys need to keep in mind as well. Okay, so when we say lengthen, I think a good one is that when we say lengthen, we don't just mean stretching. Okay, we are referring to an active lengthening of the muscle and fascia through movement, not passive stretching. So passive stretching in the long run will not restore the ability to move very well, as movement requires muscle and fascia to be elastic. So think of a rubber band, the elasticity. If you keep stretching the rubber band, it will just become stretchy. It will lose its tension. But you want tension in your body. So too much passive stretching will result in the loss of elasticity in our muscle and fascia. And if stretching is not the answer, then how do we create length? Okay, it could be as simple as after you release the tight tissues, you posture correct so that you don't keep going back into that hunch position that causes the tightness and keeps you there. All right? Or it could be strengthening. So now that we've taken care of the tight and short muscles, we're going to move on to rule number 3. Okay. What's weak needs to be strengthened. To further restore balance to the body, the weaker muscles need to be strengthened. And today we're just focusing on 2 simple upper body movements. All right, you guys ready for the first one? Ding! The push-up. All right, some of you might be very familiar with the push-up. The ability to push in the upper body and as well as the rest of the body is crucial to avoiding compensation and injury in places such as your shoulder, your elbow, and your wrist. All right, a common error earlier on that we used was the example of the rounded shoulders. This rounded shoulder position puts a lot of strain. So Kurt here is demonstrating in the photo. Rounded shoulder puts a lot of strain in the shoulder joint. All right. So you can see how rounded the spine is. Okay, and over time, if you keep practicing in this position, this poor movement pattern also restricts you from engaging the muscles that you need to engage, so the correct muscles, the correct muscle groups. Okay, over time, people executing movement like that may have anterior shoulder pain, so right at the shoulder joint here, even wrist pain or elbow pain. Right, so we're going to have a quick demonstration. I'm going to invite Kurt here to demonstrate the push-up with you guys. So all right, Kurt here is going to demonstrate the push-up. Watch and also join, feel free to join. Stick out your butt a little bit, okay? And you want to make sure that your navel is contracted. All right, I'm just going to quickly screen a photo. Keeping your weight over the balls of your feet, okay, you want to make sure that your hands are also pressed on the box. Lower your body towards the floor or the box. Lower your body, bend your elbows without changing any of this. Okay, it's very important. So keep your shoulder as neutral as possible and come up. 1 push-up. Very good. Okay, going down again. Try and maintain that stability, keeping the shoulder joint nicely in place and coming up. Okay. Okay, rest. Okay, that was, even though it's just 2 reps, it can be very tiring. All right, where do you feel the work, Kurt?
Core.
Okay, he feels his core, okay? That's good. All right, so in the push-up, even though it seems like it's just an upper body movement, you want to be able to connect the rest of your body to your arms. All right? If you're unable to do this movement, you might want to start again like this on the box, or otherwise start on the knees. That makes it a little bit easier. All right, that makes it a little bit easier. Okay, second exercise. Push-pull. Okay, a push-pull. Okay, I'm just gonna quickly show you guys. This is what we'll be doing. This push-pull results in the rotation of the body. This is crucial as it allows us to recruit a larger network of muscle and fascia, something called the slings. If you guys haven't heard of that before, that's okay. But the muscular slings are very important to help us generate torque. These things come in very handy when you do things like running, throwing, sprinting, tennis, softball, golf, you name it. Anything that requires you to rotate, that requires you to push and pull well. Okay, some common errors with executing this movement is pulling with a high shoulder and pushing with a opposite depressed shoulder. This could very easily cause neck and shoulder discomfort. Okay, you can also end up with a lot of compression in the side of your body or your shoulder right over here if you're always compressing and pushing or compressing and pulling, whichever side that is. If you look at the next image, shifting to the side. Another common error is also a side lean as you're pulling, or a forward throw. Too much of a forward lean when you're pressing. All right, so moving with these inefficient patterns over time will not only create discomforts, it will also create movement compensations that will be tougher to change in future. Okay, so let's just see if we can do this. I'm gonna invite Kurt here again to just take a seat. Okay, keep a neutral position. So neutral sitting position, pull the navel in, make sure that the chest is nice and inflated, so don't slouch. So slouch. So you don't want to push like this. Okay, that's really important. You don't want to push like this. You want to make sure that you are nice and tall. Very good. So now, hands in front of you. Okay, some of you might choose to use bands for this. For this exercise, we will use a band. Okay, we will use a band. So Kurt will be holding on to some bands. All right, so he's going to pull in his left and push with his right while rotating his thoracic spine. So you'll see that at the end of the movement, he's facing you guys. Okay, a bit more. Good. So you should feel your obliques working, not just your arm. You should want to make sure that it's open and not slouching, so slouch. So if you're pulling like that, you can very easily damage. You'll get the rounded forward shoulder position again. All right, so from the back view, so turning around, you want to make sure that your hips in the middle, you're centered, you're not leaning to one side as you push and pull. So let's get Kurt to push and pull. Good, good. Keep your arm up a little bit, right? Yeah, and rotate a bit more. So turn, turn, turn. Good. Okay, good. This is a very nice thoracic rotation. Where do you feel the work, Kurt? Okay, he feels big muscles. That's very good. He feels a connection across different muscles, front and back. All right, you shouldn't just be feeling your arms working. All right. What a lot of people tend to do is retract too much as they pull. So when you pull so much and push and pull, rotate, such that your body has gone off center, okay, and this becomes compression. Okay, this becomes compressive more than actually active. Okay, so what you want to do is create space, okay, yep, and you rotate from the thoracic, not just by pulling in the shoulder. Okay, so that's important. Okay, relax it right. So these are just two simple exercises that you can try on your own. Although we're only focusing on a few specific errors here, you come to realize that there are many different combinations of compensations that occur. In situations like these, it's best to look for a professional who can help you to identify the problem and work on the issue together. Just a shameless plug here. So if you're interested to actually fine-tune your movement, come down for movement consultation. All right, that's a good way to start working on your movement habits and movement patterns. So we've just gone over three major rules to help you stack your body. Rule number one, what's tense needs to be relaxed. Rule number two, what's short needs to be lengthened. Rule number three, what's weak needs to be strengthened. Okay, if you guys, and with that, that's pretty much what we have for you today.